Pleasant good day, everyone. Now listen to me. Whoever took the man Bera, the bracelet, you know the one we're talking about, give it back to the man, please. Let me explain to you why. This is a new Ministry of Health administrative building at Queen's Park East in Port of Spain. It has office space for over 800 people, conference spaces with over 32 conference and meeting rooms, a digital library for computer access to digital records, a daycare and breastfeeding room, 2 fully outfitted gyms, and I understand there's also a fully outfitted catering kitchen. It has been built by NH International at a cost of 280 million TT dollars, which we have not yet paid for. We will be buying it on a lease to own arrangement with NH International at a cost of 471.3 million TT dollars over a 15-year period. This, by contrast, is the St. James Medical Complex Administration Building. It is also where the Cancer Center of Trinidad and Tobago is located. In it, there is a pharmacy where the chemo drugs are mixed for the patients. On the last 3 occasions that I went to receive chemo treatment, I got treatment once. And on the last occasion, there were 37 people scheduled for chemo that day and only 10 people got. I was not one of them. Every time you miss a treatment, you're effectively starting the cycle of treatment again. More money for the taxpayer. Now, I'm not quarreling that I didn't get exactly. If I don't have it, don't have. And there are people nearer the grave than I am. So it's only fair that they should get before me. This is not a problem. However, on behalf of the 26 people and myself that did not get chemo when they were scheduled to have, I would like Minister Dayal Singh to do us a favor, because this has been going on for months. So it's not just that 26, it's all the others for months now that missing treatments. I understand that the filters required for the fume hood in the pharmacy need replacing, and that they are sitting on a dock in the United States of America waiting to be shipped, but there's a strike in the dock. Well, I'm sorry, Minister Dayal Singh, but we really need you to be proactive. We need you to hop on a plane and go and fetch the filters and bring them down here. Now, if I had money, I would go and get them, but I was born in Belmont, grew up in Cobo Town, had a very good education that I was privileged to have, but I still end up poor. I have no money to go and fetch nothing, but you do. And don't send nobody on a contractor. This isn't contract money required to fetch these filters. Just hop on a plane and go and get them and bring them down. Right now, what is happening is that Port of Spain General is mixing the chemo. They're doing that and doing the chemo for St. James as well. And it seems they cannot mix enough in a day. So who don't get, don't get. And on top of that, they mix in and send in all at the same time. So it doesn't matter how early you reach there in the morning. If you get in, you will sit down there until 2 o'clock in the afternoon waiting for the chemo to arrive. You understand? Now, we know the chemo drugs are time sensitive. However, it have Coast Guard sitting down, not Coast Guarding, because they have no ships, but they have motorcycles. It have regiments sitting down. Well, I don't know if they're regimenting, but they have motorcycles too. How about running a convoy system of motorcycles? As it mix, bring it so people can get their dose of chemo in a timely fashion and not be there all in the night. That is being proactive. Let us do something about the situation instead of just saying, oh gosh, we can't make. And don't use the police motorcycles, because we need them to be doing policing, right? And finding bearers, right? So here's my next favor now. Whoever stole that Bera, please give the man back his Bera. I heard police hold 2 men for the theft of the Bera, but I didn't hear that he actually got it back. And that is obviously what is missing. We need Minister Dayal Singh to get back his juju. Whoever holding the Bera, and somebody must know where it is. Wipe your fingerprints off it, put it in an envelope, and post it to that nice brand new shiny administration building at Queen's Park East. He go get it, and with it he will get back his juju. When he get back the Bera now, he'll have back his juju. His brain will go into action again. Please give the man his bracelet so he will get his juju and start thinking again, and he will get proactive and fetch the filters. The situation is just insanity. We're already sick, and you're making us sicker. All the doctors and nurses deserve a pay rise. And boy, do they deserve it. It is a madhouse what they have to work in. More like 18th century conditions. And now I'm thinking about it. Maybe Mr. Elias of NH International could give us a loan for the filters and we'll lease buy them back too. I'm not joking, you know. Because if it is that we don't have any money to pay for the shipping and something else going on that nobody telling us about. Mr. Elias, you think you could just sort out those filters so that the people who need chemo treatment could get the treatment? Just as a favor to the nation, you know, it'd be kind of nice. I'm not begging, but yes, I'm begging. If anybody knows Minister Dialsing, please make sure he gets to see this. If anybody knows Mr. Elias, please make sure he gets to see this. And if anybody knows who is holding the Bera, please beg them, give the man back his juju. Like, share, and comment. Any questions, put them down below in the comments, and if I can, I will answer them, and if I can't, I will direct you to the Minister of Health. Thank you all for your time, my people. Stay blessed.